Millions of people wake up in the middle of the night and stare at the ceiling, wondering why their body refuses to sleep. For many, it starts with small changes, waking up at 3 a.m., struggling to fall back asleep, or feeling exhausted even after spending hours in bed. At first, it may seem like a temporary problem caused by stress or a busy schedule, but over time, these disturbances can turn into a persistent pattern known as sleep disorder. Understanding why sleep becomes disrupted and how it affects the body is the first step toward restoring healthy, restorative rest. Sleep disorders refer to a group of conditions that affect the ability to sleep well on a regular basis. These disorders may involve difficulty falling asleep, staying asleep, waking up too early, or experiencing poor quality sleep that leaves a person feeling tired during the day. According to sleep specialists and research referenced by the National Institutes of Health, sleep disorders can interfere with the body's natural sleep-wake cycle and disrupt many essential biological processes. Sleep is not simply a period of rest, it is a critical time when the brain processes information, the body repairs tissues, and hormones that regulate metabolism and immunity are balanced. One of the most common forms of sleep disorder is insomnia. Insomnia occurs when a person has persistent difficulty falling asleep or staying asleep despite having the opportunity to sleep. Some individuals may lie awake for long periods before drifting off, while others fall asleep easily but wake up repeatedly during the night. Many people with insomnia also report waking very early in the morning and being unable to return to sleep. Over time, chronic insomnia can lead to fatigue, irritability, difficulty concentrating, and reduced productivity during the day. Another major sleep disorder is obstructive sleep apnea, a condition in which breathing repeatedly stops and starts during sleep. This happens when the muscles in the throat relax too much and temporarily block the airway. As oxygen levels drop, the brain briefly wakes the body to reopen the airway, often without the person fully realizing it. According to health data often cited by the Centers for Disease Control and Prevention, sleep apnea can severely fragment sleep and prevent the body from reaching the deeper stages of rest that are essential for recovery and brain function.
Restless leg syndrome is another condition that can disrupt sleep. Individuals with this disorder experience uncomfortable sensations in the legs, accompanied by a strong urge to move them, particularly during periods of rest or at night. These sensations can make it extremely difficult to fall asleep and may repeatedly wake a person during the night. While the exact cause is not always clear, researchers believe that neurological and genetic factors may play a role. Sleep disorders often develop gradually and may be influenced by multiple factors. Lifestyle habits are among the most common contributors. For example, using smartphones, computers, or televisions shortly before bedtime exposes the brain to blue light, which can suppress the production of melatonin, the hormone responsible for signaling that it is time to sleep. When melatonin production is delayed, the body's natural sleep rhythm can shift, making it harder to fall asleep at the desired time. Caffeine consumption later in the day can also interfere with sleep. Caffeine is a stimulant that blocks adenosine, a chemical in the brain that promotes sleepiness. Drinking coffee, energy drinks, or strong tea in the late afternoon or evening may keep the brain in an alert state long after bedtime. Even if a person eventually falls asleep, caffeine can reduce the depth and quality of sleep throughout the night. Alcohol is another substance that many people mistakenly believe improves sleep. While alcohol may initially cause drowsiness, it actually disrupts the structure of sleep cycles later in the night. As the body metabolizes alcohol, sleep becomes lighter and more fragmented, leading to frequent awakenings. Over time, relying on alcohol to fall asleep can worsen sleep problems rather than solve them. Environmental factors also play a critical role in sleep quality. A bedroom that is too warm, too bright, or too noisy can prevent the body from entering deep sleep stages. Sleep experts often recommend maintaining a bedroom temperature between 18 and 22 degrees Celsius, keeping the room dark and minimizing noise disturbances. These conditions help signal the brain that it is time for rest and support the body's natural circadian rhythm.
Psychological stress is another powerful disruptor of sleep. When a person experiences ongoing stress, the body releases higher levels of cortisol, the primary stress hormone. Elevated cortisol can keep the brain in a state of heightened alertness, making it difficult to relax and fall asleep. In addition, stress often leads to racing thoughts at night, which can further delay sleep onset. The consequences of chronic sleep disorders extend far beyond simple fatigue. Sleep is essential for maintaining nearly every system in the body, and persistent sleep disruption can lead to serious health consequences. Research summarized by the World Health Organization indicates that long-term sleep deprivation is associated with increased risks of cardiovascular disease, weakened immune function, metabolic disorders, and mental health problems. One of the most immediate effects of poor sleep is impaired cognitive performance. When the brain does not receive sufficient restorative sleep, attention, memory, and decision-making abilities can decline. People with chronic sleep deprivation often report difficulty concentrating, slower reaction times, and increased risk of accidents, particularly while driving or operating machinery. Sleep disorders can also significantly affect emotional health. Poor sleep is closely linked with mood disturbances, including irritability, anxiety, and depression. In fact, the relationship between sleep and mental health is often bidirectional. Sleep problems can worsen mental health conditions, and mental health conditions can further disrupt sleep. Another important consequence of sleep disruption involves metabolic health. Lack of sleep can interfere with hormones that regulate hunger and appetite. When individuals do not get enough rest, levels of ghrelin, the hormone that stimulates hunger, may increase, while levels of leptin, the hormone that signals fullness, may decrease. This imbalance can lead to increased appetite and cravings for high-calorie foods. Sleep disorders can also weaken the immune system. During deep sleep, the body produces and releases proteins called cytokines, which help regulate immune responses. When sleep is consistently interrupted, the production of these protective proteins may decline, leaving the body more vulnerable to infections and slower recovery from illness. Fortunately, many sleep disorders can be improved with practical lifestyle adjustments and medical support. One of the most effective strategies is establishing a consistent sleep schedule. Going to bed and waking up at the same time each day, including weekends, helps regulate the body's internal clock. Over time, this consistency trains the brain to recognize when it should prepare for sleep. Limiting exposure to electronic screens before bedtime is another important step. Reducing screen use at least 1 hour before sleep allows melatonin production to rise naturally. Instead of scrolling through a phone or watching television, relaxing activities such as reading, gentle stretching, or meditation can help prepare the mind and body for rest. Dietary habits also influence sleep quality. Avoiding caffeine several hours before bedtime and limiting heavy meals late at night can reduce sleep disturbances. Staying hydrated throughout the day while reducing fluid intake immediately before bedtime may also help minimize nighttime awakenings. Regular physical activity is widely recognized as a powerful tool for improving sleep. Exercise helps regulate circadian rhythms, reduce stress, and promote deeper sleep cycles. However, very intense workouts immediately before bedtime may temporarily stimulate the body, so many experts recommend finishing vigorous exercise at least a few hours before sleep. For individuals experiencing persistent or severe sleep disturbances, professional evaluation may be necessary. Healthcare providers can assess symptoms, review sleep patterns, and determine whether an underlying medical condition is contributing to the problem. In some cases, treatments such as cognitive behavioral therapy for insomnia, breathing devices for sleep apnea, or targeted medications may be recommended.
Ultimately, healthy sleep should be viewed as a fundamental pillar of overall health, just like nutrition and physical activity. When the body receives sufficient, high-quality sleep, nearly every biological system functions more effectively, from brain performance and emotional balance to immune protection and metabolic health. If you frequently wake up during the night, struggle to fall asleep, or feel exhausted even after spending hours in bed, your body may be signaling that something is out of balance. Paying attention to these signals and making small adjustments to sleep habits can make a meaningful difference over time. Sleep disorders are common, but they are not something people simply have to live with. With greater awareness, healthier routines, and appropriate medical guidance when necessary, many individuals can restore deeper, more restorative sleep. If you found this information helpful, consider sharing it with someone who might also be struggling with sleep. Learning how the body responds to sleep disruptions can be the first step toward healthier nights and more energized days. And if you want to continue discovering science-based strategies for improving your health, be sure to stay informed and explore more educational content designed to help you live better and sleep better.